Hello and welcome to our Freedom Docs webinar. I am so excited to be here today and to talk with you all about a very special announcement. We have Adam Habig here for us today, standing in for his brother, Chris Habig, who is unfortunately out today with the kids. I think we have all been in that spot, but lucky that we get you today, Adam.
Good to be here, Sarah. Glad I can pinch hit for Chris. I know that, and thanks for everybody joining. I see some familiar names and faces on the guest list today, so hopefully you can tolerate me pinch hitting for Chris today. I think they came down with a bug, Sarah, so he's sitting this one out wisely. So
yeah, poor Chris. That's no fun, but I'm sure he'll be tuning in and with us in spirit. So why don't we go ahead and jump in? I know this is a lot of times a lunch break for people who are coming. Will be focused on the time here and make sure that we're not keeping you too long, but I do want to go ahead and get just right into it. And Adam, do you mind introducing yourself a little bit and what you do within Freedom Healthworks?
Sure. I know a lot of the folks that had signed up for the webinar, so I've spoken to them in the past, but it's been some time. So Adam Habig, president and co-founder of Freedom Healthworks. I think Chris, it tends to be the face of the franchise in many respects, but once in a while I get to jump on one of these. Most of my time lately has been spent focusing on what we're going to talk about today. So it is very timely and content appropriate, which is the new FreedomDoc program that we're launching. So excited to be here. It's a really, really cool program. I think everybody's going to enjoy hearing about it today, Sarah.
Yeah, awesome. And we're so excited to get you to talk about this with us. So for those of you who are tuning in for the first time to our webinar series, my name is Sarah Harker, and I am the business development manager at Freedom Healthworks. So I'm the face that you'll most likely see as you start looking into direct primary care and thinking about opening your practice. I'm sure I know that there are a few of you in here right now that I've talked to in the past, and welcome and thank you for coming back. As Adam said today, we're going to talk a little bit about FreedomDoc and a new announcement with a program that we're offering that helps kind of really prevent the three main risks that we come into when we start talking with people looking into opening their own practice with direct care. So let's go ahead and hop into some of our questions. Adam, I know what we really want to focus on are those three main points today. When I'm talking with people and they're first setting up, starting to think about where do I even go with this, we come to really three main issues every time. And so let's talk about those and how FreedomDoc is really combating that and making it a smoother sailing option for those getting started.
Sure. It's no secret. I've said this before. I know we pound this drum quite often that Freedom Healthworks exists for one reason, and that's to make it easier for doctors to upgrade to a direct care practice. That's it. In doing so, we, over the years, have continually probed for the next barrier that's preventing doctors from doing that. It's no secret. Many doctors are aggravated, burned out. They're fed up with the system, right? We talk about it all the time, but what is it that holds them back? There are challenges to making that move into the direct care space. You mentioned it. We've boiled those down to three distinct challenges that we've identified that are common. Every doctor that's done this has encountered these three challenges, right? Number one, the transitional risk. How do I get from where I am to where I want to be? Always a big question, right?
Right.
There's legal aspects of that. There are certainly process issues. There's just know-how that you have to understand. The second big bucket is what we call operational risk. That's if you do get there, what do you do now? How do you run a business? How do you thrive? I think the third then is what we're going to focus on today, which is what we call financial or economic risk. That's a big one. That's the toughest one to solve, which is why it's so exciting that we've come to this point where we're launching the FreedomDoc program, which takes aim at that third bucket of risk. So if you look at it in a nutshell, Freedom Healthworks, all we've done over the years has existed to help doctors mitigate these three challenges that stand between them and getting to the direct care practice of their dreams. And so we can review each of those today, but really focus on that third bucket of risk, the economic risk that FreedomDoc targets.
Yeah, perfect. I think, when I'm talking with someone, that's often the first question I hear is, I had one credit of business class in med school, and I don't know what I'm doing, but this feels like the right path for me. Am I the right fit for that? And I think that really falls under that transitional spot of, am I a good candidate for this? Is there someone who isn't a good candidate? Do you want to touch on that a little bit?
Sure. Yeah. You mentioned there's a lot of noise in the space, and we know that. And we are, I like to say, here at Freedom Healthworks, we're friends with anybody who's helping to move the system, move people from the system and the unhappy state they're in into a direct care practice. We're all for it. However they find their way there, however you doctors find your way there, good stuff. Go for it. We're here to help if we can. If we're not part of the equation, so be it. But there are a lot of voices out there, and I think what's really important is anytime a physician considers this track, they have to address all three buckets of risk. And you can't just address and check the box number 1 and number 3 and leave number 2 unchecked. You can't do that. There are a lot of voices. There's message boards galore. There's a lot of chatter.
Right.
And a lot of them are saying, hey, direct care is within reach if you would only download a checklist, and then you can learn it all yourself and maybe get advice from a colleague on nights and weekends. If that works for you, great. I think that's still a bit fraught with risk. You're not addressing all three buckets of risk, right? There are other groups that say, hey, if you just purchase a certain set of software, it kind of sort of helps you run a business, and then you can join an employer network and voila, patients just drop out of the sky. Again, that's not quite addressing all three buckets of risk, right? Certainly, if those approaches work for some folks, great. For early adopters, for mavericks, but we think the majority of doctors want something that is squarely focusing on all three buckets of risk. And so that is really what we've addressed with the FreedomDoc program, right, Sarah? We've taken each of those types of risk, transition, operational, and now financial, in concert, single-threaded those into a programmatic approach that really, defrays, lowers, and mitigates that risk that a lot of doctors are seeing and holding them back from making the move to direct care.
Right. I think, we love metaphors around here, as everyone who's ever attended a webinar knows. And I think it's always great. I always say, I know that you're perfectly capable of starting your own DPC and following those, checklists and things like that. But what it comes down to is, do you have the time and do you have the finances to afford the mistakes that come with that? With tackling a new project, we often refer back to it as building a house. Sure, you can build a house. You went to med school, for goodness sakes. If you can get through that, you could build a house on YouTube step by step, or you could work with somebody who's done it hundreds of times before and knows the flow and knows the right setup there to get you going faster and into your house.
Absolutely. You hit on a good point. It's not about having the capacity to do it. A lot of times it's business is all about the old equation, time is money in many senses, right? It really, you have to look at not only can you accomplish what you're trying to do, but how long will it take you? How much time, effort, and energy will you have to invest in getting there? And then once you arrive at that point, I think it's very important to remember that, there is a massive difference between thriving and barely surviving. And that's one thing I want to draw a beat on. It's not enough to say, well, okay, I've checked box 1, I scratched and clawed my way to check box 2, and now I'm going to bootstrap my way into box 3. Okay, you've checked the boxes, but again, there's a difference between barely hanging on by your fingernails and reaching the level of low stress dream type practice that you really are targeting with this. And if you're starting down this path, that's where you're trying to land, right? Is in that dream practice. But it's within reach. That's the good news. And I think if we look at those risks, kind of take them one by one, to reiterate kind of what Freedom Healthworks has been focused on and continues to focus on. Number one, how do we mitigate the transition risk, right? To start out, how do I get to a point where I've launched and now I'm into business, right? Well, part of the FreedomDoc program really takes what Freedom Healthworks has built and really tightens that down. There is, on the front end of that, a thorough evaluation, financial modeling, and an analysis really of each market to determine if a direct care practice will thrive in that market. Really, direct care can succeed almost anywhere. We've proven that, right? Across 37 states now, supporting doctors in every aspect of the business. But within those markets, what I call micro markets matter tremendously. So it's not just saying, well, will direct care work in XYZ city, but where in that city is it appropriate? Where's the best place to site a practice? Those things make tremendous differences, right? The other part of that, not just the market screening and the micro market screening, but the physician candidate. You mentioned a minute ago that this may not be appropriate for everybody. And sadly, that's the truth. I mean, there are eligibility requirements. We do that not to try to exclude people, but the opposite. We want everyone that launches to have a very high confidence level of success in this program. So yeah, it's not for everyone, but I'd say, for most doctors who come to this and have, the right mission in mind and like the parameters of the program, it's going to work for them. But there will be times when it's just not the right fit. And we do that really to help both sides. We don't want any failed implementations, failed launches, down the road. But what that adds to, I guess, the culmination of that analysis, Sarah, is what I'd call a tightly choreographed launch process that minimizes the drag and the downtime and the costs that you encounter prior to go live. This is different from other approaches in the marketplace. Certainly, like you said, you can build that house on your own. I think what you sacrifice there is that that's going to be a very sluggish process. We've had doctors talk to us and say, gosh, it would take me 3 or 4 years to gather this information that you're putting at my fingertips to try to bring the program together, soup to nuts. Starting a business, which is what a practice is. Starting a business is hard. In this day and age, there are a lot of things you need to be aware of, not simply regulatory, legal missteps, that kind of thing, but just, getting your doors open is tough in any business, let alone in the practice of medicine. So this first hurdle, this transition hurdle, this, hurdle to launch, we'll call it, is difficult. This is where a lot of doctors get, they're deterred. They're intimidated by this. I don't blame them. They never get beyond this first hurdle.
That's right. It's a where do I start situation. And I think, that's an easy transition over to the second hurdle, which is what you called our operational risk. And I think that's another one where we see a lot of those mistakes that come in, especially the one that I hear about the most, especially if it's someone who has started and then found us and thought, oh, thank goodness someone else can do this for me, is typically they've started dreaming up the practice. They're looking with realtors, and the realtor hears, oh, they're a doctor. And they start showing them these huge, what I call the Taj Mahal of practices, these marble lined buildings and beautiful, really built up, expensive places to start. And oftentimes what I'll hear from people is they have a specific view in their head of what the practice will look like, but they haven't really thought through the other side. And even sometimes they're thinking, it's more important for me to throw money at what the practice looks like than it is to spend on marketing. And they're actually skipping over that part, which are two really big pieces of this operational risk that we help provide.
That's right. The bucket number 2 of risk, and these again are services that we provide along with the transitional assistance, but the operational risk mitigation really involves what I call right sizing operations to ensure the practice has longevity. Certainly, we've heard the cautionary tales of what you're describing exactly. Doctors who have launched, who have committed long-term to too much space, too heavy of a burden for the practice to support in terms of cash flows. It's one of the quickest ways to sink any business, let alone a direct care practice, right? What we try to focus on are implementing lean, centralized business operations within each FreedomDoc practice with integrated systems that enable maximum physician focus on patients, right? It's another cautionary tale would be the practices who overstaff from the very beginning. Because again, overhead is overhead, whether you're paying too much in rent or you have too many heads, that you're supporting on the payroll. It really is a matter of, can you right size the practice, the staff, the operations? And one of the things we do with FreedomDoc is that we provide a lot of those services from a centralized basis. So there's not a head in the practice doing something, it's done off site in a very efficient, centralized manner. So it helps keep those overhead costs down. I'd say those are two big ones. The other, the big one that kind of dovetails into the third bucket of risk, Sarah. And I'm not trying to move too quickly, but I know the focus is on this.
No, sure.
Is adding in what I'd call a really robust growth engine. right? It's the marketing and advertising. It's a support team that we've built at FreedomDoc, really, that attracts patients to your practice and does so from a diverse set of sources. And that's one thing that's very different in terms of certain approaches in the marketplace. You hear a lot of buzz about attracting employers and employer lives, and that's great, but that should only be one tool in the toolbox. Because a third cautionary tale that we hear so many times is practices that are overly reliant on employer lives are also subject to seeing those lives disappear year to year. Benefits plans change, employers close up shop, or they move, or they let people go. And if you're too exposed, if your patient panel is too heavily reliant on exclusively the employer channel, you tend to put that practice and the finances at risk at any given time. So what we try to do is build patient panels within the FreedomDoc practices that from a diverse array of sources. We do a lot of localized marketing, bringing in consumers from that geography. We know exactly who we're trying to target in terms of consumers, who's going to enjoy a practice like this. And we spend resources trying to reach them and get them, to look at the practice, take a look, and ideally enroll. That's different too than a third option, or I guess a fourth cautionary tale at this point, which is folks that spend a lot of time and money hiring localized, just general marketing advertising agencies. And not to, dismiss their expertise, because they're very good at what they do, but they're not focused on this space. And so when you have a broad approach to market to many different types of customers, many different types of industries, you don't really have the focus necessary to draw patients in an efficient way to this. So we've had those tales. That always breaks our heart when doctors come to us and say, hey, I've started up on my own. I've got this big space, got this big staff. I've spent a bunch of money on marketing, websites, advertising, this whole thing. Help, it's not working. Why not? Well, it's not that the ingredients are wrong. You've got the right ingredients there to bake the cake, but it does take the expertise to put them together to single thread all of that. That's one of the big things we do here at FreedomDoc. So that's big risk bucket number 2. Number 3.
Yeah. Good. Let's hit number 3. That's the one everybody's waiting for anyway. And it's the number 1 objection that I hear. Financial risk.
Financial risk. This is one that's the toughest to crack, right? It's one thing to launch a business, one thing to operate a business. It's tough in any industry to know who's going to show up and when, and how can I rely on this for my future, right?
Right.
The bottom line is, even after mitigating those first 2 buckets of risk, you're still going to need capital to start up and survive and thrive in any business. That's any business, any industry, Sarah. Startup capital, working capital during those early months when the business is still cash flow negative, growth capital to spend on marketing and advertising and outreach, critical. And then you've got to have some kind of money to live on. Anybody does, right? Whether that's savings, whether that's, you've got other household income, you got to have some way to keep the lights on at home while you're building your business, right? What we find, and this is one reason why we launched FreedomDoc, one was clearly to unlock this dream of a direct care practice, to make it more accessible to more physicians out there, right? A bigger segment of the market. But the other reason we launched it is that bootstrapping often means that corners get cut. And we've seen that really, resound in a negative way to many practices that have tried this. When you cut corners and you try to bootstrap the first piece of it, say you download a checklist, you try to DIY it, you're going to miss things that come back to bite you later. And more importantly, it's going to take you a lot longer, and time is money. Again, you spend 3 years trying to get into business, you're going to spend a lot more time and money and effort doing it than if you work with us and you're there in 90 days. It's night and day, 3 months versus 3 years, right? If you underspend, you cut corners on the marketing and the growth, you're just not going to see the patient attraction, the patient volume to help build the recurring revenue to see your practice break even and eventually thrive. And if you're bootstrapping on the home front, taking out a third mortgage, eating ramen every night, we all joke about it, but part of that is, people start businesses like that all the time, and it's tough. Though. And the other thing that leads to is focus. Sarah, is often not concentrated on building the practice. Maybe they're trying. Maybe a doctor who's bootstrapping on the home front is trying to work another job or 2 other jobs, or there's stress involved in that, right? That's human nature. There's stress. What FreedomDoc tries to do is eliminate all of those elements so that no corners are cut on any aspect of this practice launch. It's a programmatic approach that delivers capital to fully fund the launch and the early months working capital needs for this practice. It delivers capital so that there is a robust growth budget for marketing advertising so that we see patients flowing into the practice at a steady rate. And it delivers capital to provide a minimum monthly income for the physician to keep the lights on at home and fully focus on growing that practice. So that is the big reveal there. That's the FreedomDoc program. It's a way that we have taken the best of our Freedom Healthworks expertise, baked it into a very streamlined, very programmatic approach. And now we are bringing capital to the table that surmounts that third obstacle, that challenge of the financial risk, in hopes that this opens up access to direct care for more physicians.
I love that. That gets me so excited. I think I heard a client recently who we were talking with about FreedomDoc. She described FreedomDoc as independence that's wrapped in support. And I thought, man, we should pay her for that line. Because it's exactly that. It's giving you that financial independence and that focus so that you can really practice care the way that you want to without all of the red tape. But you've got the support of a whole team behind you, whether that's the operational, the risk has taken off of the operations there, the transitional, and also the financial support of a team. So thank you for taking the time to explain that.
Yeah, best of both worlds. I totally agree. I want to make one distinction this year. This is not employment. Just before anybody, this is not employment like the hospital sense where you're working for the system. That is not this at all. Okay. This is still independent practice. This is your practice as a doctor. You have, as you mentioned, the backing and support of a full service business management and growth platform, right? And you have the power of the FreedomDoc brand, the FreedomDoc platform, but it's still your name and likeness on that practice, and it is your practice as a doctor.
Yeah. Awesome. Thank you. Well, let's hop into some questions we have coming in here. I see one in the chat. And you already took care of the second one, which is, so you're employing doctors. And can you talk just a little bit about what it looks like to be in a FreedomDoc practice when you're saying it's your independent practice and how you want to run it, but there's this team? What does that division of labor look like?
Yeah, I will talk about it. And I would also encourage anyone who's interested to reach out and speak with physicians who are practicing today in this program. We didn't just decide to hold this webinar today on a Friday and say, well, we're going to do this sometime in the future. No, it's been underway for many months now. We've been working out the kinks in the model. So please do reach out and ask that same question to a physician who's already in a FreedomDoc practice and hear for yourself. But really, it's a simple division of labor, Sarah. Everything and anything that has to do with treating patients, clinical expertise, medicine, that's completely the doctor's domain. We touch none of that. We are there to work only in the background and support the practice from a business and administrative side of things, marketing, advertising, regulatory, legal support, all those things, accounting, bookkeeping, all the things that get in the way and that stand between a physician today and in regular practice and in patient treatment, as well as again, because we're in direct care, by nature of the model, a lot of that admin headache is already gone. There is no billing, reimbursement, collection headache anyway. It's just by nature of the model. But that's the division of labor. Our practices, we run them very lean to keep overhead low. The doctors, like I said, are completely in charge of everything clinical. FreedomDoc participates as a business management partner, but our goal is to make each FreedomDoc practice as turnkey as possible, consistent with each doctor's input and preferences.
Okay. All right. Let's go into, we've got a couple questions here in the chat. It sounds like this person is not super familiar with direct care yet. So why don't we back up just a tad and explain what we mean when you say direct care and what that looks like. They were asking, is this similar to insurance? And what are the risks and fees that come for patients joining that? Can you explain just a little bit about what that difference is for this physician?
Sure, from a patient standpoint, you're talking
Mhm.
direct care in
Yes.
general. Yeah, it's membership in a practice. It is not insurance, and it's complementary really to high deductible insurance that's very prevalent today. So again, if you're not familiar with direct care, this is where patients will enroll, and usually families enroll all at once, and they will pay a monthly fee on a recurring basis for full access to that office and the services offered within that office.
Mhm.
There is no insurance reimbursement or assignment done at the office. Patients are free to submit their charges if they'd like for reimbursement if they have out-of-network coverage or some other type of arrangement with their insurance company. We know patients have been very successful getting reimbursed, but the whole idea is this is something that is paid for by consumers or employers at some point outside of the insurance realm. And for that reason, it cuts out a lot of the nonsense that and the admin headache that doctors deal with day to day.
Thanks. Another question we have here, they were asking where we located, and we are actually based out of Indianapolis, Indiana. That's where where Freedom Healthworks was founded. But we are a national company, as Adam mentioned. We're in 37 states now with different practices, and are able to launch you wherever you may be, as long as you're in the United States.
I'd say the FreedomDoc program we are rolling out here close to home, but it will be rolled out in other markets very soon. So just if you're interested in this and you don't happen to live next door to our HQ, that's okay. We're coming to your neighborhood very soon.
Very soon. Okay. And then one more. How do you deal with non-compete clauses? I'm a doctor and I have non-compete in my contract.
The dreaded non-compete.
Dreaded.
I'll say this, number one, we have never been precluded. We've never had to tell a doctor we can't go forward because of your non-compete. Right? They are ugly. We obviously don't like to see them in there, and we feel for you if you're trying to navigate around one. All non-competes are limited in three ways. This is my legal hat. They're limited by geography, they're limited by the scope of practice, and limited by time. So typically we're navigating around those three prohibitions in order to find a way for a doctor with a non-compete to get into practice. So in some cases that means, okay, we've got to move the practice site outside that protected halo. Not ideal, but usually not a showstopper. In some cases, we do it temporarily while the clock runs out on the 12 or 24 month prohibition. I think look, I'll wave the flag here. Indiana just passed legislation. I believe it's on the governor's desk for signature that bans non-competes, at least at the primary care level going forward. So the trend is to protect doctors from non-competes, and so they are not getting between you and your patients going forward. But I'll say this: if you would like to dive into your particular circumstances, Sarah, I know we're always happy to try to help doctors navigate around whatever's written in that contract in a legal way. I mean, not trying to violate the contract, but we often find ways to do it. We just had one the other day, and where there were explicit clauses in that contract that said, hey, if you go back to private medicine, that doesn't count. You're fine. And so we said, great. There's a nice loophole that there is really no non-compete standing in the way. But it's a problem. I think the trend nationally is to do away with those, or at least lessen those across the board. So we attorneys don't have them. I always ask legislators if non-competes are not good for attorneys, why in the world are you allowing these for doctors? And there's never a real good answer for that.
Yeah, that's a good answer. And that's a common one that we get, is about that non-compete. I think we've got time for one more question. We're getting really close here for trying to keep this under 30 minutes. And as Adam said, there's always a place to talk through these questions further. I'd love to hear from you. I'll put my email address here in our chat, and you can reach out to me at any time to talk this through a more customized version for you as well. Are there any other questions or anything else that you would like to discuss, Adam, or leave the webinar on?
Yeah, thanks for tuning in, everybody. I want to emphasize that this webinar was not meant to lift the hood and look at all the moving belts and pieces of the motor under the hood, right? This is about why we're doing this, how it exists, what it's supposed to do. If you take anything away from this, the new FreedomDoc program is a very streamlined approach that helps doctors who might be discouraged by the capital requirements and the financial side of this, the risks that entails from pursuing or from exploring direct care. FreedomDoc helps shoulder the early risks of a practice launch, and in return shares in the long-term upside and profitability of the practice. This is our formula we've landed on to help open this up to more doctors. It's not for everyone. I think it's a very deliberate approach, very data-centric approach to addressing all three of those buckets of risk, Sarah, that we talked about. So if you're interested in this and you're out there listening right now, please reach out. This could be for you. Our goal is that we say thriving is not surviving. Okay, the goal is to prosper and enjoy practicing medicine again. Contact Sarah, take our suitability test, see if you'd be a strong candidate for this FreedomDoc program and the capital support that comes along with it. Talk to some doctors already in it. Might be for you, but we're excited to start rolling this out.
Yeah, to see if you're a good fit. I think that's great, Adam. You summed it all up. I think the big thing for me with FreedomDoc is it just feels like it's such a, when people get stuck at that part of like, is this accessible for me? Can I really get there? Can I make it all work? If those are questions that are in your mind, reach out and we will help get you set up with those things that Adam mentioned and figure out the answer to that. The more people we can get to direct care and the faster, the better it's going to be for all of us involved. I also wanted to mention one more thing. I loved how you said to reach out to one of the docs and hear from them. Dr. Anastasia Boyer, who's located in Zionsville, Indiana, recently launched her practice in January, and Chris Habig, Adam's brother, and our CEO here at Freedom Healthworks just did a great podcast on Healthcare Americana, interviewing her and talking about the process and all that she's experienced. You can find that on Healthcare Americana. You can also feel free to reach out to Dr. Boyer herself. She's a big advocate for this type of this type of way to practice care. So she would love to hear from you as well. I think that's all we've got for today. So thank you so much, everyone, for joining us. And please, again, don't hesitate to reach out. And thank you, Adam, for being here. I really appreciate it.
Enjoyed it, Sarah. Thanks, everybody.
Have a good one.